So I want to talk about malignant hyperthermia, and this occurs with exposure to acetylcholine or any other types of general anesthesia medicine. So it normally occurs, under the while the patient is under anesthesia, but it also can happen in the recovery phase, and it's triggered by trauma, heat, or stress. But what happens is the patient starts to spiral down. So the patient has muscle rigidity, so that means stiff as a board, right? Tachycardia, fever, dysrhythmias, tachypnea, hypotension, stenosis. The patient starts to plummet. So this is an emergency. So what you want to administer is dantrolene, and this can reverse the causes of it. We want to stop the triggering anesthesia. So if they're getting anesthesia and everything, we want to stop that, and we want to hyperventilate our patients. If the patient is having some kind of EKG changes, then there's medicines to help with that. If the patient is acidosis, acidotic, we want to do all those things. And if their core temperature is greater than 39 Celsius, you want to initiate cooling. So you just want to make sure that like dantrolene, that is for malignant hyperthermia. But one of the biggest things is we want to make sure that we prevent this. So during the pre-op phase, we're going to see, hey, do you have any history of anything going wrong under anesthesia? Do your family have a history of anything going wrong under anesthesia? And it is one of those things that patients, they normally don't know. Who knows this stuff until it actually happens to you? So if a patient has malignant hyperthermia during the procedure, then they need to let the rest of their family know so they can be tested before surgery. But yes, so you want to make sure that you definitely know the signs and symptoms of malignant hyperthermia and knowing the medication